Hi everyone. It's been a long time. I haven't posted in quite a few months. Actually, I think it's been a year or more. My name is Maddie, and this is Maddie Vlogs. Welcome. So, if you don't know already, I am a registered nurse in Oregon. My silence has been rather intentional. COVID 19 hit about 2 years ago, pretty hard in the United States. And since then, our health system and healthcare has changed drastically. I graduated nursing school in December of 2019. Right when I graduated, that's when the pandemic hit. I initially worked at a primary care office, but then later switched to a hospital where I was taking care of COVID patients day after day after day. It's been exhausting, to say the least. Not only are the COVID patients sick, but so are our other patients as well. Patients who have waited too long to get medical treatment. Our staff are leaving left and right. Nurses are quitting, they're going to travel positions, CNAs are leaving. When that happens, that puts an enormous amount of stress on the nurses still remaining. It's tiring, to say the least. The purpose of this video is to inform you about the challenges that healthcare workers have faced throughout the pandemic. Every night is something different, but you're always preparing for the worst. That one patient who kicks you in the head, bites you on the hand, cusses at you, yells at you, screams at you. That COVID patient who desats, you're running in there without any PPE on, trying to save their life. Meanwhile, they're combative, they don't understand, they're frustrated that they're in the hospital, they want to leave against medical advice, but you know if they take off their oxygen that they are going to die, and they do not understand. Every day is a challenge. And then on top of that, to be short-staffed, to have CNAs who are not around, to have nurses who are quitting left and right, to have CEOs of the corporation not being able to provide the funds for their staff, yet they are getting bonuses and able to provide money to these travel agencies. It's frustrating, to say the least. Not only do we risk our life every day, but we suffer from it. The ones who take care of you are the ones who need your help the most. It's a horrible time right now to be in the healthcare field. My heart extends to all of you healthcare workers who are out there right now, fighting day after day, exhausted, mentally burnt out. It's so not easy. I'm going to share something personal with you about how this COVID pandemic has affected me and my mental health. So I have a history of anxiety and depression. Well, this pandemic has definitely triggered a relapse, you could say, into anxiety and depression. I leave the bedside every night feeling like I didn't do enough. I feel defeated and like my patients aren't happy. They're not satisfied with the job that I did. And as someone who suffers from depression, I take those messages and I internalize them and I beat myself up. And I know for some people it's so easy to just cast it out and be like, oh well, don't listen to what they said. But for someone with depression and anxiety, It's not that simple. You internalize it and you start to believe it. And as being a new nurse myself, I'm still trying to learn the ropes. And everyone around me is burnt out. They're tired. They're exhausted. Imagine trying to navigate as a new nurse when everyone around you is frustrated and tired. And you're just trying to learn. And they get mad at you, they yell at you, and you cry, and they think that you can't handle it. It's horrible, horrible. It's the way that our health system is right now. So, with those internal messages, I come home every day and I beat myself up. I think about what could I have done differently? How could I be a better nurse? How could I have cared for this patient more? Was it something I did? And I spin and I spin and I spin and I can't get these thoughts out of my head. Then from the mere exhaustion, the fatigue of going sometimes 17 hours without using the restroom, 12 hours without grabbing a bite to eat, or even sitting down for a split second. It gets exhausting when you just sit down to chart and a patient is calling, or another patient is bed exiting, or your COVID patient is desatting and you have to run in there to save their life. And no one understands. Your other patients don't understand. Well, where were you? I called 15 minutes ago. Where were you? I've been eating water for an hour. Well, I'm sorry, the patient next to you was coding, and I needed to be somewhere a little bit more important than your water. I'm sorry. It's exhausting. I sleep for days. I don't eat. I've lost like 15 pounds. And I know that doesn't seem like a lot, but for someone of my size, that's significant. I didn't really have weight to lose. I'm not eating. I'm having heart problems. Something needs to change. Something needs to happen. People need to understand that the way that our healthcare system is functioning is destroying our healthcare workers, the people who are going to take care of you. People like me, people like my coworkers that I care about. We're all miserable, some worse than others. And some of us have pre-existing traumas and anxieties and depression that predispose us to make it more difficult for us to handle the stress. But everyone is experiencing burnout. Everyone is having mental health challenges right now and physical challenges. And that's scary. I'm scared. If something doesn't happen, we won't have anyone left to take care of us. So I just want you to be, if this message means anything to you, I hope that it will instill the need to have compassion with your healthcare workers. We're burnt out, we're tired, we're doing the best that we can. Oftentimes we're functioning on very little sleep, we're malnourished, short-staffed. It's hard when you have 5 patients and no CNAs, and you're in charge of their assessments and their meds and toileting them and giving them food and calling the doctor and being in charge of everything that's going on. It's not easy. It's hard. There's CNAs for a reason, because a nurse isn't supposed to do everything. Yes, they technically can, but a CNA is there to offset that. So nurses can actually focus on being there for the patient and noticing those acute changes that go wrong and call the doctor and prevent a code or, prevent death, essentially. Nurses are the forefront of patients, and we are the eyes of the patients. We advocate for you. And when we don't have adequate staffing, when we don't have adequate support to be able to do that, your healthcare suffers. This is a problem. And I hope something changes very soon. It needs to change, because we can't keep going like this forever. Thank you for listening. If you are a healthcare worker, please know that you are not alone. Times are hard right now, and you're doing the best that you can. Proud of you, and you should be so proud of yourself too. It's really not easy. Please take care of yourselves. Much love to all. Bye.